This podcast is made possible in part by WKTV Community Media.
Welcome to the Be Nice podcast, where we dive into conversations that help us to recognize, understand, and take action when it comes to mental health and suicide prevention. I'm Christy Buck, your host. The Be Nice action plan is simple: notice, invite, challenge, and empower. 4 steps that can change lives. Together, we'll share real-life stories, insights, and tools to break the stigma around mental health and inspire positive changes in our communities. Our guest for this episode is Yana Papadakis, a forensic psychiatric charge nurse, currently working towards her master's as a psychiatric mental health nurse practitioner. In addition to her work, Yana runs Thinami, or I guess Dynamite, but I say Thinami because it's a great Greek word, a social media account dedicated to normalizing mental health conversations, breaking stigma, educating community members, and fostering a safe, supportive community. Yana is going to share more with us about her experience from both the frontline and advanced practice lenses. Sounds a lot of technical stuff. I know Yana. I've known her for years, and I really saw her take a hold of so many conversations that were necessary during the pandemic. And I'm proud to have her here today. I'm proud that she is moving towards another degree, and so it's an honor to have her here today. So, Yana, typically I start off with myth busting, but being that that's a passion of yours, I'm going to throw out some of the myths that I would have busted today, but I'm going to allow you to bust them for me. Sometimes it sounds better not coming from me all the time. Let's start with getting your thoughts on busting this myth. So, psychiatric nurses aren't real nurses. Help me to bust that myth.
Yeah, so I mean, the first thought that comes to mind about that is these are still patients. They're still people that also have medical comorbidities. So my argument, especially as a charge nurse, is that we often need more staff and more support because patients come in and they have, they're usually in a psychiatric crisis of some kind, but they still have all their medical stuff going on, so we have to take care of both the medical and the psych. And oftentimes those one affects the other. So I'll give you an example. I think sometimes if somebody comes in such a big crisis that they're not able to care for themselves, they really, really do need help caring for their medical stuff as well. So I mean, I think every type of nursing is different and unique to its own specialty. So, there's going to be different things. I'm not doing what they're doing in labor and delivery, and they're not doing what I'm doing, for an example. But I think every specialty has its own unique aspects to it, for sure.
Absolutely. And, I've worked in psych for 39 years. And it's so interesting. Back 39 years ago when I first started on this road, people were on a lot of antiquated medicines, right? And a lot of people at that time entered into state institutions, right? Back 50 years ago, 60 years ago. And that 39-year point back then when I started was the closing of state institutions. And at that time, it was really sad because people were coming out of hospitals without any family waiting to greet them, right? Can you just talk about and touch on the essential need of families to be involved in the process of psychiatric care, working alongside nurses like you, walking side by side with psychiatrists and other counselors and whatnot?
Of course, yeah. I mean, that's definitely something that's very important in a patient's care. And in their treatment plans, one of the first things we do when somebody's admitted to an inpatient psych unit is talk about their risk factors and their protective factors. And a protective factor, a big one, would be what kind of support system they have, whether that's friends, family, whatever that may be, whatever that may entail for the patient. We always try to incorporate that support system, that protective factor into a patient's care plan, because we recognize and see that this is going to be a short stay, hopefully, in the inpatient psych unit, but what's really going to be even harder is when they are discharged and they don't have the support of the staff. And so we need to try and figure out a plan of how they can be best supported once they are more stabilized and able to finally be discharged from the unit. So that is one of the most important pieces of a patient's treatment plan.
I love it. And I love the word protective factors. You're backing up, be nice. And the action plan of empower the knowledge about those protective factors. And, I think when we let family members know that you're part of the plan and you can help this individual stay stronger and stay on their medicines and stay in treatment. I just absolutely love it. You know, oftentimes, and I know that this is a frustrating part of any psychiatric illness, and it goes hand in hand with biological, physical illnesses too. People don't want to stay on the course of the medicines that they are given. What kind of tips can you give some family members that might be listening today, which, you know, we know that that can be really frustrating in that journey of getting healthy?
Of course. So I think the first thing with medication that I always try to touch on with my patients is patient education. And a lot of times it takes trial and error, which I think can be very frustrating for patients, that it can take time to find, the right med, the right dosage and all of those things. But I also emphasize too that a lot of times when patients are feeling good, it's because they're on the right med and it's doing its job. So I always am having open and honest conversations with patients about that, because one of the biggest reasons people tend to end up back in the inpatient psych unit is because they stop taking their meds. And a lot of times when I ask them, hey, what's going on? Why did you stop taking your meds? They're like, oh, I felt fine, so I didn't need them. And so I think it really is just centered around the importance of patient education and, you know, letting them know how these meds work and why they're feeling the way that they're feeling, so that it's not just, oh, just take your meds, just take your meds. There needs to be a why behind it. There needs to be information behind that. And people I've found are much more likely and open to that process once they have more education around the topic.
I'm so excited about this next step in your career. And, you know, we did a little research on this, and psychiatric mental health nurse practitioners, that's big, are advanced practice nurses who can assess, diagnose, I get the chills on this one, and in so many places prescribe treatment. This is a huge advancement in this field to see the importance and the role that nurses play. And you know, I feel that my own medical journey has been with a nurse practitioner, and it's exciting to get that piece of compassion that you are going to bring to this field. How did you get started, and where was your desire and this field for passion rather than going that physical health route?
Yeah, for sure. You know, I think my passion started when I was in nursing school. I liked my other clinicals, but psych was really where I found my calling. And it's kind of just, I've never looked back from there. But I think especially a part of it is once I started working as an RN on the psych floors, I really saw, unfortunately, how much the stigma was still affecting my patients within the medical community. And so there's a big stigma, I think, just in general. I think that over the years, it's become less because of more education around this topic. But I think seeing that even within the medical community has been difficult. And I think that's especially like another like subset of my passion of, you know, breaking that stigma within the medical community among other healthcare professionals. So I think that has been something I'm very passionate about. You know, I wanted to go the NP route because I want to be more autonomous with my patients. I want to have more of a say in their care plan, as opposed to right now I'm helping carry out care plans, which is still very important. But I would like to be more of that, you know, starting A to Z, kind of how are we going to get through this? What are we going to do? And let's come up with a treatment plan together with my patients. So that's kind of the goal.
Absolutely. So are you going to be working with all populations, meaning, you know, kids, adolescents, middle age, and then also seniors?
So I do have experience working with kids till seniors. I personally, my forte is high acuity adults. That's why I'm in forensics right now. So those are patients that are deemed incompetent to stand trial by reason of mental illness, and also the NGRI population, which is not guilty by reason of insanity. So I work in a very specialized subsection, but I have in the past worked inpatient psych, and that's where I got a lot of my experience starting out as a new grad. And those are when patients are admitted to the inpatient psych unit for either danger to self, danger to others, and or gravely disabled. So I have a lot of experience with different diagnoses, different populations, but me specifically, I think my passion really aligns with the high acuity adult population.
All right, huge stuff. All right, forensic, let's go down that road of one of the biggest myths, and that is that people who are diagnosed with a mental health disorder are violent, are dangerous. Let's bust that, because you are on the forefront of working with folks that, sadly so, ended up going to jail or going to a psychiatric facility. Go for it.
Yeah, so, big topic. I think a lot of what doesn't help that stigma are things like horror movies and the way things are portrayed with like insane asylums and straitjackets and those types of things. I think that attaches a fear to this topic that is kind of misunderstood, I think. I will say, like, there are patients that are dealing with psychosis at times, different types of traumas, different, issues that they come in with, different crisis moments. But most of the time, patients that I work with are not violent. I will say, like, you have to be aware, because you just have to be aware in general with any type of nursing, I think. But a lot of times it's just really getting in there in their crisis moments and helping stabilize them so that they can like think the way they want to think and act the way they want to act. And especially with the forensic population, I will say, I have had to deal with aggressive patients at times, but that is not the majority of the population. The majority of the population is actually pretty chill, which a lot of people are very surprised when I say that.
Yeah.
And a lot of, like, I'll run groups and I'll go play basketball outside with my patients. Like, and when I tell people that, they always get surprised because they're like, well, aren't you like scared to do that? And I'm like, no, they're people just like us, and they're just dealing with a different issue that maybe somebody else would be. And, just kind of getting more on that humane level of we're all just human beings dealing with different issues. So
exactly. And you've seen so many times where, and you use this term several times about stabilization. So we're really pretty proud of some work that's been done here in Michigan, and that is specifically with a new facility in Grand Rapids, and it's the crisis stabilization. And it is a place where police they may be confronted with a violent scene, that someone may be experiencing a psychotic episode, maybe drug-induced, whatever, and they take them to that center as opposed to jail or to ER. So it's proving to be quite successful. Are you seeing more of these? Have you heard of this type of facility?
That's amazing. I think I've traveled a lot, so it differs between which state I'm in. I think Colorado is trying to come up with more of these crisis stabilization centers, but I will say that there is mental health care in jails, but it's not great. My patients come to me directly from jail or prison. So I really get to see kind of where they're at and what treatment they have or have not been getting in that prison system. So I really do think that is an amazing step for this process, because the difference between somebody even escalating or not escalating in that crisis moment is kind of how they're perceived and how they're taken care of in that moment, and also where they're taken. I think jail and prison can be a traumatic place, and if somebody's already in a mental health crisis at that moment and you kind of just exacerbate it by taking them to the wrong place, I think that can obviously not be helpful. So I think that's a huge step towards progress.
Absolutely. And do family members get involved in this, or is it more that, this crime, the reason that they distance themselves?
I've seen it go both ways. I think it depends. I feel like, unfortunately, a lot of times by the time the patients get to where I am in a forensic hospital, they have kind of a long history of psych stuff. So I think it depends on how long they've been dealing with stuff, if it's their first offense, kind of what the whole situation is. I've seen it go both ways. I've had like patients, families call me and say, we don't want to get calls about this patient anymore, unfortunately. They don't want to be updated. And then I've had the total opposite, where they're there for their visitation hours every single day and very much a part of the care plan. So I really have seen it go both ways. I think it really is just dependent on the patient's situation overall.
Absolutely. So tell me about VNUMMI. I love it, and I loved watching you create and develop. Tell me the development, the name, what's going on now, all that good stuff.
Yeah. So VNUMMI is a Greek word for strength. I think it started during COVID times when I just really was like, I feel like I'm learning so much about this population and mental health in general, and I feel like all of this should be common knowledge. I really do believe that you don't have to do what I do for a living to be an active participant in this conversation and helping to work towards progress with this conversation in general. So I think bridging that gap I found was education. And so the main point of VNUMMI is to, give education and kind of tell people what's actually happening on the front lines from my position of things I see every day, and kind of like taking that fear off of things that are unknown, because I found the more that people understand something, the less they're afraid of it and the more they're willing to talk about it and get to know more of the proper information. And then I've also found that it also encourages more people to seek the help that they may need by talking about these conversations. So, Vita Me was just started as a platform to just really try and open up the conversation and kind of build a safe space that people felt they could hopefully come to talk about some of these difficult topics.
I love it. And, we started our journey together, understanding the enemy, obviously. And then we had the opportunity to work with the Greek Orthodox Church and build training methods to make sure that we bring on folks that are working with youth. Tell me about how that made you feel being part of a movement within a church, and oftentimes a place where understanding is not happening about mental health disorders, mental illness.
I think that was a great project that we worked on. I think I'm very, very big on prevention because I oftentimes see, like I mentioned, people like have years and years of a psych history and they're just now getting help. And, I really try to dive into why is that happening? Why are we not helping these people before they get to this point of like crisis moment where we only have a certain amount of options. So I think I'm very big on prevention. I think especially starting with kids, I think the more that we talk about these conversations and get, resources out there, like you were mentioning the 988, is really helpful. And I think prevention is not discussed enough. And I think also within sometimes a religious setting, I think sometimes people will say things like, just pray about it. And I think that kind of, I don't think people have bad intentions when they say things like that, but I think there's a misunderstanding of what can really like help them. And it kind of makes a person feel like, well, I must not be praying hard enough if I'm still feeling this way. And I think it's okay the way that we seek priests out or, pastors for different things. I think it's the same concept of like, we have all these tools in our church to utilize. We also have all these tools within the community to deal with mental health diagnoses, if that's the case and if that's what you're needing help with. So I don't think there should be any shame attached to, getting the help that someone might need.
Agreed. Load people with those protective factors, right? And we know that a priest, a church can be that protective factor. So we need to understand that everybody's welcome here, right? No matter what is happening, you are a member of our community, of our church. I love that now you're going back, right? Because you're going to be working on this next step in your life. Where do you see the road taking you? Would you ever want to go actually into be a psychiatrist, or do you see that this is that level? You're going to get that piece that maybe as a community we should see that it is a level of a different profession name, but it's there. Because I'm seeing that what you can do, that's what psychiatrists do.
Yeah, exactly. And I guess that's maybe another myth we could bust.
Yeah.
People just have a misconception because there's a lot of different providers now. We have physician assistants, nurse practitioners, psychiatrists, we have the whole gambit now. So no, once I am a psychiatric mental health nurse practitioner, I will be able to do what a psychiatrist does: evaluate, treat, diagnose, and depending on the state you're in, the laws differ, but I am able to be an independent provider in the state of Colorado, and that is my plan, to be an independent provider, like the same way a psychiatrist is. So I think that's an easier way of explaining it, that I will be able to do what a psychiatrist does, just to kind of make it more simple terms.
Absolutely. So, Yana, how do you protect your own mental health?
Mm-hmm. Yeah, I think a lot of times, people ask me how I do this work, and I think a lot of times it's trying my best to not put my emotions into something, because I do see and hear a lot of difficult things. So it's not about me in that moment. It's about the patient, and it's about what I need to be for the patient to help them in their crisis situation. I think I'm good at doing that. And I think that's also like what helps me throughout my shifts, and being able to think clearly and, do what I need to do to help that patient. I think outside of work for me, I really do try to keep a balance of work life. What happened on shift, I try to keep on shift, and I try not to take my home life to work with me as well. I think the same goes, but I think building those protective factors, I'm very close with my family. I'm very close to my faith, working out, reading, being involved in social aspects. I coached a basketball team. So really, delving into the things that I'm also passionate about outside of work, I think helped me maintain a good balance and maintain me being able to help people because I'm at my best self.
Absolutely. I love it. Anything else you want to add about any more stigma that you wanted to touch base on? It's your chance right now.
I mean, I think this is something that the Be Nice Foundation already talks about a lot, which is great. I think there's a big misconception that talking about suicidal ideation is going to like put the idea in someone's head. But I really do believe, and I've seen in my practice, that being able to sit in that space with somebody who's having those thoughts and being able to like just be there for them and hear them out, actually, I found actually decreases their suicidal ideation. That's what they told me. And it actually encourages them to seek the care and the help that they need, because they don't have those thoughts just in their head. They finally told somebody, and like somebody is there to help. And so I have found personally, and I've had those conversations with many patients, that just being there for them and opening that conversation to them in a safe space actually can make a huge difference.
You got it. And today, I was telling you earlier before we started our podcast, it was brought to national attention that suicide rates amongst teens, youth, has gone down. And this is absolutely huge. And I'm just going to say, it is the enemy. It is Be Nice. It is spreading that word, reducing that stigma. It's not only 988. I'm going to say this. It is people letting people know that it's okay to pick up the phone. It's okay to pick up the phone, be with a friend, and help them to make that call, right? And I think driving and pushing out that don't be embarrassed or ashamed. Get help and treatment. And I see exactly you as being part of this change that's happening right now. I'm so proud of you. And it's a lot of dedication. I'm going to be praying for you as you make further moves. I'm going to be looking at you on a national scope at some point. One more question I do want to ask is, the percentage of people going into this field, what does it look like? And being in that nursing, right? What a percentage of nurses actually are going that route of, one, psychiatry in general, and then two, this. I mean, this is big stuff.
Yeah, I don't know an exact percentage. I would have to look that up, but I will say even within the psych community, there's very many aspects and ways that you can go. There's telehealth now, there's outpatient clinics, there's rehab clinics, there's so many different ways. I think I can just say from my own experience, I'm part of a smaller population that loves and is very passionate about inpatient psych and also forensic psych. They're just very hardcore specialties, but that is really where my passion lies. So it's great though to see that there's so many different ways you can go, and there's so many ways you can help people. And I see that even within my class right now, my NP class, there's so many different things that people want to do, whether it's substance abuse help or telehealth and all these different aspects and ways you can go. So I think I'm on the lower end of like people that go into forensic psych, but I think that just makes me even more passionate about it because there's such a high need for it.
You got it. I want to remind people right now that, the Be Nice Action Plan is so essential to using it before a crisis happens. And that is having the knowledge about what mental health is, right? And you said this too, Yana. Knowing what it is, knowing what mental health is, knowing what those signs and symptoms are, and most of all, knowing risk factors, right? And recognizing that somebody might be in harm to themselves or others, inviting myself into that conversation, getting that person help and assistance before they harm themselves or others. I think we're so essential in recognizing this before it gets to the point where someone ends up being arrested, going to court, anything that goes along with when their mental health disorder was unmanaged, right? And it never has to get to that point. I'm such a believer in that. And that goes along with school shootings. It goes along with crimes that happen on the street. Someone noticed, someone saw that there could be a potential crisis.
Yeah, no, I agree. And I would just add to that, I think sometimes I've found that people think that that's not, like noticing something is always going to be a noticeable sign. But the way I kind of explain it to my patients and family members is, what is something that maybe is not their baseline? Because somebody could be very high functioning and still be very depressed.
Yep.
And they might appear fine to the outside eye, but that's why we really need friends and family to notice what is their baseline, what is their norm, and anything that is different than that, is a potential sign for they might need some help.
You got it. I love it. Thank you for listening to today's episode of the Be Nice podcast. Together, I think we busted some major harmful myths that keep people from seeking help and treatment. I hope that these sharing of conversations that we're doing are helping folks understand the importance of notice, invite, challenge, and empower, obviously. If today's episode resonated with you, share it with someone you might need and you want to help somebody else. We're going to be sharing this out to many different communities. Remember, don't forget, if you or someone you know is struggling, there are resources available. Please utilize the 988 phone text line. Visit our website, find out more information. Visit our website and see how you can bring it to your community, to your athletic team, to your school, to your business, to your church. For now, be nice.
This podcast is made possible in part by WKTV Community Media.